Hello. So my case study was on PVNS, pigmented villonodular synovitis. Basically, the presence of idiopathic benign tumors all through the articular space attached to the synovium. There really is no determined cause. There are some links to a gene mutation. There's also, I think, valid evidence around a past history of trauma to the knee and just something about the continuous inflammation to that area causing hyper proliferation of these cells. Um, our case specifically is a softball catcher, extensive history of MTSS and Auschwitz slaughters, general knee problems. Um, and in the spring semester, she was having issues with her shins, had a couple scans, was addressing that. And there's just some vague notes about some oddities in her tibial plateau we should probably look into. Never really did. Problem went away. When practice started up again this semester, she started having knee pain. And you could see like a pocket of swelling around lateral to her fat pad, exact spot of bursitis. So we kind of just tried to push through it and address it. Corticosteroids, oral, topical, isocompression, rehab, nothing helped. It was just continuously getting worse until October. She got to the point where she couldn't do anything. She couldn't bend her knee, she couldn't land on it, couldn't jump. So we went and got an MRI, and initially we didn't really see anything, but the radiologist pointed out multiple up to like 2 centimeters oblong size masses, and a few smaller ones dotted throughout. She also has an ossicle coming off her tibial plateau from her history of Auschwitz slaughters, but we are going to ignore that for now. She went through an arthroscopic synovectomy. You can do open synovectomies, but arthroscopic just has better results in terms of recovery. It was successful. Biopsy came back non-cancerous, confirming PVNS, and the incidence of reoccurrence is like 30 to 50%, specifically for localized one joint, kind of caught early. It's much less likely to come back, but I'm sure she's a sophomore. She's 2 more years. We'll probably continue to keep an eye on this, possibly have follow-up scans, everything of the like. But if she, by the time we get through rehab and get her back at activity, she's pain-free, we're good to go. Here is a picture of the surgery. This is actually a picture of an open synovectomy, but you see here these big pigmented masses that they're taking out. This is her on the left, day 2, pretty much right after surgery. You can see the main port that they went through. They had, I think, a total of 3 ports open. A lot of swelling. And that was our biggest issue with her. She was being pretty non-compliant about elevating and icing, and she ended up having some breakthrough bleeding through this port. She has a really low pain tolerance, so we were having a lot of trouble getting her to push the range of motion because she didn't have anything repaired. We were able to start off first week working on a range of motion, but she was having a lot of trouble. But this is her now. Definitely a lot of progress. I'm pretty happy. At this point, she's still kind of swollen, still notably swollen, but obviously moving forward. Initially, she had a loss of, I think, about 10 degrees of extension and was only getting to about 40 degrees of flexion. Had a pretty big deficit. Now she only has about 2 degrees left of extension to get. If we really pushed it, we could probably get it. And I think at resting without pushing it too much, she's at least at 90 degrees of flexion. So she's made a lot of good progress. This is the in-between. You can see, if I can zoom in a little bit, this port that was really starting to blow out. This is where she had some breakthrough bleeding, because this is where most of the trauma was from the surgery. You can see where we put some KT tape on over this to try to get work through this. This is her more recently. You can see where I put some tape on the bike. That was her first time on the bike. That's all she was really giving us on half moons. That was a tough day, but this is her now, able to get a full revolution. I think we are now, this was October 20th was the surgery. So we are about 4 or 5 weeks out, making decent progress, but she is a catcher. Our goal is to get her back by spring, obviously like late January. She needs pretty extreme range of motion, and we're basically just really trying to make sure she doesn't end up with any gait problems, kinetic chain problems, and maintains the strength in her hips so she doesn't have any continued problems. Our goals as of right now are basically to get her off the crutches without a limp, get her walking around on her own, maintaining our elevation regimen so that she doesn't have a return of the swelling, and just keep her pain-free for right now. She's made a lot of really good progress. She still has a ways to go for the range of motion, but it's because nothing was repaired, it's a little bit more fast-moving than you normally would see. And I'm pretty happy with this. Thanks.